Hi, I'm Dr. David Musnick, medical doctor, MD. I'm board certified in sports medicine, internal medicine, and certified in functional medicine. I work at the Eagle Clinic branch of functional medicine of Idaho. I'm going to talk today about an injection technique called Prolotherapy. It's a branch of regenerative medicine. So Prolotherapy started about 70 years ago and has been done for many, many years. I myself have probably been doing this for 26 plus years. The reason to do prolotherapy is either to work on tendons that are degenerative, that's called tendinopathy, or small tears in tendons, or to work on loose joints. So how can a joint get loose? Well, a joint can get loose if someone had a sprained a joint, injured a joint, and overstretched the ligaments, but they didn't go back to normal. How would you know, or how would somebody know if they had this condition? Well, the joints can make noise. They can go out of alignment. That's called subluxation. They can be painful. The areas around the joints can be painful, or what often happens is muscles go into spasm near the joints, and people are complaining about the muscle spasms, and you could get a massage or two and it won't relieve it. It will just come back because the muscles are tight to stabilize the joint. And you don't want muscles that tight. You don't want that kind of pain. But also, one of the risks of having hypermobile joints is they can turn into arthritic joints. So this is a good idea if you're wondering if you have a hypermobile joint to get it evaluated. One of the things that I do in my sports medicine practice here is evaluate people for really any joint in the body for hypermobile joints. What are the most common ones? The neck, especially in auto accidents, the neck can be hypermobile. That can cause neck pain, muscle spasms, or even dizziness. The ribs can go out of alignment. The low back can go out of alignment, and especially the sacroiliac joint, which is the very lowest part of the back, below the lumbars. And as a matter of fact, the sacroiliac joint is one of the most commonly missed joints where it is the problem, but doctors are just looking at the discs and the lumbars. If your sacroiliac joint is out of alignment, you'll have pain in your upper buttock near the sacroiliac joint. You could even feel like it's difficult to walk, or you are almost buckling, or it's painful when you walk. Other joints that can be loose are the shoulder, the elbow, the thumb joints, ankles, knees, and hips. So really, almost any joint in the body can be loose. So prolotherapy is an injection technique. Commonly, dextrose is used, sterile dextrose, but other solutions can be mixed with it. Other items can be mixed with it to make it stronger. The needle is placed right on the ligaments that need to be strengthened, and the purpose is to get the body to build more collagen and fibroblasts. This is the structural tissue of these ligaments to get it to be stable. And this allows us to have stability with motion, as opposed to if someone has a fusion of a joint, there's no motion. This is very functional, very physiological. We get stability with motion. And also, it's especially good for people with Ehlers-Danlos, because people with Ehlers-Danlos have a hypermobility syndrome, and they have many loose joints, but it's good for anybody with a loose joint. All you need is one loose joint to be a candidate for this procedure. So what's injected? Sterile dextrose. Other things could be in the mix, depending on what your issues are, what your condition is. If someone has Ehlers-Danlos, I definitely strengthen the mix, because the research shows that people with Ehlers-Danlos need more than dextrose. The average person will do fine with dextrose. Does everybody need PRP, which is platelet-rich plasma? No, most people don't need it at all. It's much more expensive. It's very inflammatory, but it's very appropriate if we need to fill in a tendon tear. That's when it's really appropriate. But otherwise, prolotherapy with dextrose or with other things works just as well, and is less painful, less inflammatory. So This regenerative type of injection is really helpful. It can decrease the risk of arthritis. It can decrease pain. It can help people be stronger. It can help you get back to your activities. And it's really not that uncomfortable. It may be uncomfortable for a very brief period of time, but it doesn't last. And it's well worth the stability that you get, or well worth the tendon healing that you get. And at Functional Medicine of Idaho, you're working with somebody, me, who has 26 plus years of experience and thousands of cases, which you do want that kind of experience. So if you have any questions about that, we'd be glad to answer that for you. But consider being evaluated initially, and then consider the treatment of prolotherapy.